Elle had no shortages of experiences with healthcare, for both good and bad. She had offered a lot of praise for many of the doctors and hospitals she sought care from, and these made the negative experiences stand out much more prominently. She described one experience from a few years ago. Quote, "My daughter fell in a seizure. She broke her jaw in 3 places. It was pretty bad. We called an ambulance. Awesome 911 operator, awesome EMTs. They were really gracious and really good to us. The problem didn't happen until we got to the hospital." There was an older lady. I'll never forget her. She looked like she had a sweet face, but when she came into the room, she was so dismissive of every single thing that we were saying, and she was dismissive of my daughter's pain. They got back the x-rays from her face, and it was a hairline fracture. With hairline fractures, it's very hard to tell on the x-rays. And she's like, "Well, your daughter is just complaining. Of course she's going to feel bad because she fell. You should just take her home." And I found myself in a situation where I had to be kind of nasty and be like, "You're going to have to drag us out of the hospital. We are not leaving. Something is really wrong." She's sitting there crying. By this time, she came out of her seizure. She was out of her aura. So she was very conscious of what's going on. And she's like, "Mom, my face feels so terrible. It hurts. Everything hurts." The provider is just like, "Well, I don't see anything wrong with the x-rays." And I'm like, "Please look again." And this woman was so incredibly nasty. And she basically accused my daughter of being a hypochondriac. And I had just seen her next door. And I'm not trying to compare apples to oranges because every child hurt is a problem regardless of color. But I did happen to notice that there was a little white boy next door. And he was adorable. Blonde hair, blue eyes, the cute rosy cheeks. He was adorable. And he had gotten into something, got a cut. They had to give him a couple little stitches on his arm. He had a little boo-boo. And she was oohing and awing. "Oh, maybe you ought to get this type of antiseptic." Any other time, they would tell you to go to the pharmacy and get some Neosporin. But she's like, "Oh, we can prescribe him this, and we can do that." And she was so helpful. So I just knew when she came into our room, we were going to get that same type of help. And that didn't happen. I had balked so much and argued so much. By this point, the residents and doctors who were at this hospital came and they all huddled around. That's how I came to be attracted to this hospital. Because you argue with them enough, they're going to say, "Okay, let's see what she's talking about. Let's take a second look." They all look at the x-rays and the professional is like, "Oh my gosh, right there, hairline fracture, boom." And it went into a perfect triangle. Now she has to be admitted. They apologized. They were so good, and we got the best plastic surgeons. You can't even tell it happened now. But that woman particularly just kind of let me know that if you're not really paying attention, people's personal opinions will interfere with their professionalism and interfere with what they're supposed to do. End quote. I want to just take a minute to applaud Elle for standing up for her daughter like that. It can be easy to say that the doctor knows what they're doing or that it can't be that serious if they didn't find anything. But Elle's story demonstrates that as a patient and as a parent, you should really trust your instincts. I saw something similar happen to a woman at a different hospital with a much worse outcome. She came in with severe abdominal pain and had a CT scan that the radiologist read as normal, and she was sent home. She returned to the hospital the following day as the pain had gotten so bad she could no longer eat. When they did a second CT scan, and upon review of the first scan from the day before, a massive cecal volvulus was seen. Essentially, the area where her small intestine joined her large intestine had become twisted around itself, cutting off the blood supply to that section of bowel. By the time she was taken to surgery, the section of bowel was dead, and so much gas had been generated by the tissues dying that the twisted section had become inflated to the size of a football. A portion of her small intestine and the entire right side of her large intestine, also called the ascending colon, was removed. This wasn't a case of the problem being difficult to see. This was a case of the budding balloon of intestine was simply overlooked. In fact, as a jab at radiology, I was sat in front of a computer as the medical student, and therefore bad at everything, to read the CT scan from the first day, and the volvulus was clearly visible and correctly identified by even my inexperienced self. Fortunately, this woman survived. After 2 days in the hospital, she was able to go home with a massive scar and about a foot less intestine for her troubles, but no other complications. Now, it's unlikely that the intestine could have been saved if the radiologist was more diligent or the ER doctor had double-checked the scan. I spoke to her surgeon, and he admitted he doesn't attempt to untwist the intestine when he sees this kind of condition, so truthfully, she would have undergone the same surgery. What she would have been spared is a massive infection risk, 24 hours of pain, possibly a day as an inpatient, and a bigger scar, as the incision was widened multiple times to accommodate the size of the inflated volvulus without popping or untwisting it. This is a bit of a tangent. The point I'm trying to make is that you should always speak up if you feel like you haven't been heard. If something feels wrong, you know yourself better than anybody else. To backtrack to Elle's story, there is something else that is striking about it. Elle was able to observe this same provider with somebody else. This isn't an example of a provider just isn't very good at their job, because Elle saw that, in fact, she was excellent at it. She was caring, compassionate with another patient, willing to go above and beyond the usual standard of care to make sure that that other patient got the absolute best result possible. She is clearly a wonderful provider, where very cute, blue-eyed, blonde-haired little boys are concerned. Often when discrimination happens, it's more of a gut feeling. As others in the series have described it, they just get a sense that they were being dismissed. By pure chance, Elle was in a situation to see care as others were able to expect it and contrast it with her own experience. It was a rare opportunity. However, she also had another experience that left her and I in no doubt that it was driven by racism. Quote, "My daughter had a crazy asthma attack, and so we went to the hospital. The ER was so crowded, and I knew they were short-staffed, so we were trying to be really patient and everything. My daughter got to the point where she's like, 'Mom, I really feel like I can't breathe.' So I'm like, okay, we really need somebody." And this guy, he was a student. He was like, "Well, she doesn't look pale, so she's just overreacting." And I said, "Have you ever been around black people? Do you know what black people look like pale? It's almost impossible for us to get as pale as you think we should get." And he said, "One of the symptoms is being pale." And I said, "Look, do you see how brown she is? How pale is she going to get?" When my daughter fainted and collapsed to the floor, then they brought in the whole staff to come help her. They saved her. She didn't die. Her heart didn't stop or anything like that. But when she physically collapsed, we were like, "Are you kidding me?" It was like somebody's comic relief, something you'd see on Saturday Night Live. Like, nah, she's okay. And in the background, she's like, and then finally faints. And you're like, really? He had the humanity to come and apologize. He said, "I really didn't understand. I thought, she was overreacting, and I'm sorry." And I was angry by this point, so I did hang him on. And I was like, it was because she was black. It was because she was black. Finally said, "Okay, fine, yeah." And I was just like, get out of my face before something bad happens, end quote. I had to remind myself to take a breath after this story. I was shocked that this sort of thing could happen. Talking to physicians, they agreed there really isn't much that can be said to defend this. One thing that can be said is asthma hides pretty well, basically until someone is examined or about to die. All odds were that this little girl looked completely normal, maybe tired, maybe coughing, but generally not much else. If someone had listened to her lungs, they likely would have heard wheezing or reduced air movement, or if they checked her breathing muscles, they probably would have seen her working far harder than normal to breathe. Physicians also confirmed that being pale is not a symptom of an asthma attack, even bypassing the completely ridiculous assertion that if this little girl was sick enough, her melanin would somehow go away. They said that it's possible that this provider meant cyanosis, a state when tissue's not getting enough blood flow and begins to turn blue. Though we agreed this is a completely inappropriate point to wait for before treating asthma. Asthma can and does kill people, and it should be taken seriously. When this child started complaining that she couldn't breathe, something else should have been done. Asthma is not difficult to treat. Nebulizer treatments can be done in nearly every room in a hospital, and a dose of steroids can work wonders, I'll say from my own experience. I feel like I don't need to say too much more about this. If a child walks into the ER and ends up unconscious because of something that could have been treated effectively in minutes, the healthcare worker has completely failed to do their job. The story was also very interesting as a rare example of when it was explicitly stated by the provider that the patient was being denied appropriate care because she was too dark. I can admire this provider for being the only one that, in the course of all my interviews, someone recalled apologizing for their actions. I think it's an important step in the right direction, but I certainly can't fault Elle for still being mad at him at the time. An apology seems painfully feeble in comparison to what happened, and even more so compared to what might have happened. Now, a few years removed from the situation, and knowing that everything turned out okay, puts the story in a place where Elle could remember it and even laugh about it in places. She doesn't hold it against the hospital or even that doctor. I'll close out this video with a few of Elle's words. She talked about letting go of expectations and just taking people for who they are. As she described other doctors, quote, "You have to look at people as a whole sometimes. One of the best doctors I've ever encountered in my life, white lady. One of the best doctors all around the world. She's just one of the best people, a human." Another doctor, I like him. Everybody says he's mean, he's old, and he's grumpy, and he's very old school, but he's a good guy. He's very blunt, very no nonsense, and I've never had a ridiculous encounter with him, especially a racial encounter. For as old as he is, never anything like that. He practices what he preaches. You know, if you try to call him racist, he'll tell you he was marching with Dr. King before you were even thought of. There are always going to be some really awesome people in the mix.